Good afternoon. Thank you to Dr. Brent Roussin, our Chief Public Health Officer, for being here today. And Doctor, thank you to you and to Lanette Siragusa for your ongoing, continued, reliable work, important work as you are keeping Manitobans informed through this unprecedented time. We really appreciate the work that you're doing. I'd like to begin today by offering our deepest condolences to the family and friends of those who are grieving today in Nova Scotia, and to all Nova Scotians and Maritimers. On behalf of all Manitobans, we grieve with you following the tragic loss of lives, including one member of the Royal Canadian Mounted Police, Constable Heidi Stevenson. Our hearts are with the people of Nova Scotia during this difficult time. I've communicated our condolences personally to both to Premier McNeil and also to Premier Higgs in New Brunswick as well. The provincial flag of Nova Scotia will be flown in Memorial Park until sunset tomorrow as Manitobans remember the victims of this senseless tragedy. And at this time, I'd ask you to consider a moment of quiet reflection at some point today for all the victims in Nova Scotia. Our hearts are with you all. Je vais commencer par offrir mes plus sincères condoléances à la famille et aux amis qui sont en deuil aujourd'hui en Nouvelle-Écosse. Au nom de tous les Manitobains, nous pleurons avec vous à la suite de la perte tragique de vie humaine d'un membre de la Gendarmerie royale du Canada, la gendarme Heidi Stevenson. Nos cœurs sont avec les gens de la Nouvelle-Écosse en cette période difficile. Back to pandemic topics. To all Manitobans, thank you. Thank you for staying the course. Thank you for following the advice of our public health experts like Dr. Roussin and Ms. Siragusa. This is much appreciated. Thank you for the compassion you've shown to one another by your conduct, to your friends, to your family, to neighbors, to people you may never meet but have helped by your conduct. Thank you for your efforts to flatten the COVID curve. Our number one priority during this unprecedented time is to keep you and your loved ones safe. That is why 1 month ago, on March 20th, we declared a province-wide state of emergency under the Emergency Measures Act to enable us to act quickly, to respond to the needs of our front line, and to protect the health and the safety of all Manitobans as we fight COVID-19. While Manitoba's case numbers do appear to be low, I caution, as Dr. Roussin continues to do, that this does not mean the risk of COVID-19 is low. And rather, this is a reflection of the necessary social distancing protocols and practices that you as Manitobans have put into place. This is not the time to take our foot off the brake. We must remain vigilant. We must do everything we can to continue flattening the COVID curve. We must stick to the fundamentals that have allowed us to be where we are today. And that is why we are extending the state of emergency for an additional 30 days. Nous devons rester vigilants. Nous devons tout faire pour aplatir le curve COVID. C'est pourquoi nous prolongerons l'état d'urgence de 30 jours supplémentaires. Extending the state of emergency will ensure we are able to provide the necessary resources to the front line of our healthcare system. What we are doing is working, and we must continue to do everything we can to continue flattening the COVID curve. This will be especially important as we move forward together to beat this thing, because the challenge will remain. Part of beating COVID is to increase and expand the scope of the testing that we do. CADM Provincial Labs has performed over 20,000 tests since February, and we are preparing to continue to ramp up those efforts. We're doing roughly double what we were a couple of weeks ago, and we expect that we'll have the capacity to double up on that over the next couple of weeks, again, as we further expand our testing. Our testing criteria has been expanded, so now we are able to do testing on critical service workers, whether public or private sector, who are symptomatic, and any family member who lives with a healthcare worker. First responders or workers in a correctional facility, a shelter, a long-term care or residential facility as well will be able to be tested. As well, anyone presenting with flu-like symptoms or respiratory issues in critical care centers will be eligible for testing. We are using supplemental testing and notification capacity from Dynacare. We are purchasing new Spartan cubes to allow us to test more quickly and to allow us greater expanded use in remote communities. We were one of the first provinces to sign on with Spartan Bioscience, and we are purchasing more. These actions that we have taken as a government will allow us to ramp up to perform 2,000 tests per day if necessary. For further details on expanding our testing capacity and any other topic he chooses to address, I invite Dr. Roussin to say a few words. Doctor, over to you.
Well, thank you. So good afternoon. Today we are announcing one additional case of COVID-19, bringing our total number of cases to 254. We are announcing one additional death today, a woman in her 80s, and so extending our condolences to her family and friends. The total number of COVID-19 related deaths in Manitoba is now at 6. As of this morning, 8 individuals are hospitalized. Of that, 5 are in intensive care. 144 individuals are listed as recovered, and we have 105 active cases. Yesterday, Cadam Provincial Lab performed 260 tests, bringing our total to 20,012 tests. As we were just discussing, we have expanded our testing criteria. All symptomatic workers or volunteers at workplaces that have been identified as essential services are now eligible to be tested. This includes people working in transportation, manufacturing, and grocery stores or other essential businesses. Any symptomatic person who lives with a healthcare worker, first responder, or worker in congregate setting, such as a correctional facility, shelter, long-term care, or residential facility. So I want to encourage any Manitoban with respiratory symptoms who meet our criteria to get tested, to call Health Links for further information. So this also includes anyone who's traveled outside of Manitoba in the past 14 days, anyone who's been in close contact with a confirmed case, all healthcare workers, first responders such as police officers or firefighters, lab workers who have worked with COVID-19 tests, and any individuals who live or work in the north or in remote isolated communities or in a group setting, such as people living in a correctional facility, shelter, long-term care, residential facility, or a remote work camp. So our testing capacity has increased. Right now, the demand for testing has been down, and that's why we've expanded the testing criteria further. So again, if you have respiratory symptoms, cough, runny nose, sore throat, or a fever, and feel you meet the testing criteria, call Health Links and they'll guide you for the next steps. I also want to thank Manitobans for their efforts following the strict public health advice that's been provided over the last number of weeks. I think that the numbers that we've currently been seeing are a reflection of Manitobans' hard work and dedication to protecting themselves, the people around them, and our entire community. But we still need caution. This virus is still here. We still see this virus being transmitted in our communities. So we should be cautiously optimistic, but we cannot now loosen up our efforts. We need to continue with these social distancing strategies in order to keep these numbers down. This is why we've extended the public health orders until May 1st. I want to remind Manitobans that there should be no non-essential personal travel. As we see numbers continuing to be relatively low here in Manitoba, we continue to be at risk of importation of the virus. So limiting our travel outside of Manitoba will decrease the risk of that happening. This virus is in every region of the province, so all Manitobans need to follow public health advice. Stay home for the most part. If you do leave for necessary reasons, washing your hands frequently, coughing into your sleeve or sneezing into your sleeve, and maintaining that 2-meter distance at all times. Want to encourage Manitobans to continue to access credible information. Manitoba.ca COVID-19 is a up-to-date website. You can find information regarding testing and about the virus, so I encourage you to visit that frequently. And once again, thanks to all our healthcare workers on the front line and to all Manitobans for flattening the curve. So thank you.
Thanks, Dr. Roussin. Speaking of front line, thank you for leading us in the front line in this battle. Staying the course while increasing our testing capacity is critical as we work towards safely reopening our economy, a goal that we all share, but superseded by our desire to make sure that we don't do anything that would create greater risk for the people of Manitoba and their health. We're going to flatten the COVID curve, and as we do, we'll ensure that all of us and our loved ones have a healthy Manitoba today and for many generations to come. So to all Manitobans who are doing the right thing to protect themselves and others, remember, not every generation has the opportunity to save a life, but you do. Keep doing that. Stay positive, encourage one another, help each other. We will be back. We've been the home of hope for over 150 years now, and we're not going to stop. We'll continue to be the home of hope. Le Manitoba est le foyer d'espoir depuis 150 ans. Et nous continuerons d'être le foyer de l'espoir. Together we will beat this thing. Be happy to take your questions.
Thank you, Mr. Premier. A reminder to reporters online, you will have one primary question and one follow-up. From CBC Radio Canada, Mohammed.
Hello, Mr. Premier. It's Mohammed from Radio Canada. I have a question about universities. Your government have asked universities in the province to propose a plan saying how they will cut their budgets by as much as 30% in order to help the province survive the financial crisis of the COVID-19 pandemic. What would you tell to students, professors, and staff who might be concerned by such cuts?
Well, I would say to all Manitobans, we have a front line that needs our help right now. And we have the need to find resources for that front line. Hundreds of millions of dollars has already been required, and more will be required. And so the exercise we're engaged in right now, as a family of Manitobans, is to find savings that are not on front line and make sure that we move those savings to the front line, because that is where we will save lives today, and that is why the doctor and I are continuing to ask people to observe the fundamentals, to keep themselves safe, and to protect others. So this is a planning process, and we will pursue it to find resources to protect our front line and all Manitobans.
Thank you very much, Mr. Premier, and I have no follow-up question.
Thank you.
From CBC Manitoba, Bart.
Mr. Premier, Bart McKeevis of CBC, how does cutting university funding permanently to 30%, I'm told now, help the economy in the long run? How does that actually affect the province coming out of this pandemic?
Well, let's not be unclear on this. I believe the request was for all of our Crown corporations and our funded agencies across the province to develop plans to save 30, 20, or 10%. And then we'll discuss, and there is discussion underway. Once those plans are presented, we'll have more detailed discussion on what savings can appropriately be achieved right now. But let's understand that this is a pandemic. We're in the middle of it, and that it presents very real challenges that were, frankly, that are without precedent. And so what we're asking all of those who depend upon government funding to do is to look for ways to find savings that are appropriate, given the loss or reduced need for services within their various areas of authority and responsibility. This could be Manitoba Public Insurance or liquor and lotteries, universities, Workers' Compensation Board, crop insurance, you name it. Manitobans are needing their public servants a little less right now than has been the case for some time, and I think most Manitobans, frontline, public sector or private sector, understand that. And so that's why we're taking this course of action, to find more resources which we will need for our frontline protection.
Are we permitted follow-ups in this one, Paul?
Yes, that's okay, Bart. Go ahead.
Minister Eichler has told Mr. Forbes at the Manitoba Association, the Faculty Association, that the 30% funding cut would be permanent. Is this what would you say about a permanent cut to universities?
That's a false assertion, and there's no relevance or fact in that assertion. What we're talking about is an emergency. We're in the middle of a pandemic. We need to find resources. We need to look for those resources. It's our responsibility to look for those resources, and I expect everyone to be part of helping find those resources.
From the Canadian Press, Steve.
Premier, it's Steve Lambert from the Canadian Press. Now that this emergency orders is being extended through May, we're getting closer to the summer season. The Manitoba government has the STEPS program that provides summer jobs to students, thousands of students across the province. Is that going ahead this year?
I'll have a lot more to say on this in the coming days, Steve. Most certainly it's on my mind. I wouldn't be where I am today if it wasn't for the opportunity I was given to have summer work so I could save up for post-secondary. Without it, I wouldn't have had the chance to get my degrees, and I think many Manitoba young people are in the same boat right now. So we'll have more to say on that in the not-too-distant future, certainly, but the STEP program will continue, and very likely other initiatives as well.
Okay, my follow-up is regarding some of the grants given to nonprofits. Some of the nonprofits that draw on provincial funds do so for summer youth job programs, and yet they're hearing that their funding may be cut. Can you give them any clarity on funding for nonprofits, at least those specifically geared towards hiring students for the summer?
Well, we're not doing anything across the board. The planning exercise that's underway is to evaluate and analyze and make the appropriate decisions based on facts. If people are not operating right now and helping anyone, then their grant's probably going to be reduced. If they are and they're helping someone, then it probably isn't. It's common sense.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV Winnipeg. Just wondering if you can explain how the new state of emergency and the new public health orders are different and what kind of falls under each one so people understand.
Well, so the public health orders deal with the group sizes as well as the closure of non-critical businesses, as well as now the restriction to travel to the north and the interprovincial travel requirement for isolating for 14 days. And so that's where the Public Health Act is in place. The other state of emergency is more regarding the ability to respond in an emergency through different approaches financially.
Okay, and then if we've ordered more Spartan cubes, does that mean that the validation for those tests has been completed?
No, that's not completed as of yet. That takes some time to be able to validate the cube, and it'll still take time to determine how and where they will be utilized, but they are not ready for routine testing in Manitoba at this time.
From City News, Jonas.
Dr. Roussin, I'll just follow up on that question regarding these Spartan cubes. When do you expect them to be ready, and how many could be in place?
So the timing is difficult. It's really at the research stage right now in being able to validate them. We're looking at mid-May when we're receiving a number more of the Spartan. I don't have the exact number that's coming as well as the test kits. But we'll have to have the validation all up and running, up and approved by that time. And when the test is acceptable, then we can, implement it as one such tool in our testing strategy.
And just a follow-up for the Premier, if I can, regarding the occurrence of the flattening of the curve in Manitoba. You've spoken about not sort of relaxing the measures now in place until you feel it's safe. I imagine we're going to start seeing some pressure on that end soon, given the numbers that are low. the balance that goes into ensuring the public stays safe and, you are in control of this. Can you speak on that a bit?
No, it's a great question. I guess the fact is we're in a marathon and we're in the lead, or very close to the lead in terms of the number of cases. We're lower for our size than almost any jurisdiction in the country. There's a danger in that. The danger is that people will stop exercising the fundamentals that got us in the lead in the first place. So if you're ahead in a marathon halfway, you don't stop doing what you're doing, you keep doing it. And we have to adhere to the fundamentals to make sure that we get through this together with as little damage to our people as we can possibly have. That being said, we all understand, perhaps better now than we ever did, that a healthy economy is what powers our healthy social services. And so we do want to get our people back and having the chance to work and provide their goods and services as soon as it's safe. So for that reason, we've initiated a number of different exercises to partner with various aspects of the Manitoba economy, with business groups and business individuals in each of those small business sectors. And we're developing protocols. And those protocols have to be meeting the standards of protecting the safety and well-being of the people who work in those businesses, but also of those who choose to go to them to shop. As we move forward, we hope to make progress, of course, but we can only make progress with those two things in tandem. Public safety can always and must always be our first concern, and only then, when that is addressed effectively, as we're doing with increased testing and these protocols that we're developing, can we move forward the confidence of all Manitobans who work in businesses, public and private, or who want to use those businesses for their services, that they will be safe and they'll remain safe. So this is the ongoing challenge, and this is the one we're addressing on numerous fronts.
From the Winnipeg Free Press, Carol.
Hi, it's Carol Sanders, the Free Press. I just want to know when we might get to 2,000 tests per day, and if that is the benchmark you're using for setting up on some of the orders.
Well, I'll just make it clear before I let the doctor respond that this is a capacity issue. We're trying to get ready in case we have increased demand. Right at this point, demand has been flat or even a little bit reducing, I think. Doctor, is that correct?
Correct, yes. So it is about the capacity. Given our current prevalence, the amount of testing that's getting done now is fairly appropriate. We have a very low test proportion, test positive proportion. But if we see increasing prevalence, increasing numbers, and we're going to want to be able to have that capacity in place to get up to, say, a number like 2,000.
And to clarify further, if I could, Carol, because it's an important question. We've expanded the testing now to include all those who are critical service workers, but as we expand and our economy begins to come out of hibernation, we'll have more demand for tests as stores that have been closed till now have staff who need to be tested, because they will want to be sure that they're healthy, and their customers will want to be sure they're healthy too. So the testing capabilities are going to have to expand to include the increased demand as we move forward and open up our economy. Small businesses, nonprofits, charities, even church groups and others will want to be sure that their interactions are healthy interactions, and therefore the testing will be required on an expanded basis to make sure such is the case.
Okay, and my follow-up question is for you, Mr. Premier. I want to know, the MTEU president said that they weren't getting enough information and that it seemed like your plan was, quote, written on the back of a napkin. What do you say to that, and what do you say if the union isn't playing ball about cuts and layoffs?
Well, I can only say that we're engaging in what is an unprecedented effort to try to find savings within our government because of reduced demand for many of the government's services, to let people stay working on a reduced basis, and to make sure that we are able to redirect the resources that we can find towards our front line. And I would say it makes little sense for us to pay in $2 billion over the last 10 years into an employment insurance program for exactly this type of event, and then to say, well, we shouldn't use it, we should just borrow more on our children and grandchildren. It makes no sense. So We're looking to maintain all government services that are central and important to the people of Manitoba, always. But at this point in time, there is clearly some reduced demand for some services. So we need the help of our union leaders to help their workers to stay at work. We prefer not to use layoffs, but we're asking for cooperation. We're asking for partnership. We're all in this together. And that has always been this government's goal, not to have layoffs. But if that's the choice of the union leaders, then unfortunately, that's where we'll have to go to some degree. I hope in a very small way. But nonetheless, we can't just sit back and do nothing while our front line needs hundreds and literally hundreds of millions of dollars of support. We need to find it from somewhere, and we can't just borrow our way out of this mess.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Mr. Premier, just a follow-up on MGEU. Can you speak about if you're making any headway with them and other unions on the work share program that you proposed last week for non-essential government workers?
I can only tell you, Marnie, that I'd like to not have to lay people off. I'd rather we use the EI program and had people working for part of the week. We have a lot of reduced demand in a number of areas of the public service and in the Crown corporations that needs to be responded to. We've paid $2 billion over the last 10 years into the employment insurance program so that people would be able to have a continuation of income, and it makes little sense to not make use of the program at a time when we need it and instead suggest that we should just borrow more money and pay people when there is a reduced demand for their services. So I'm asking for the cooperation and the partnership of our public sector union bosses to keep a model going that doesn't force us to do layoffs. I'd prefer not to.
And my follow-up question is for Dr. Roussin again on the possibility of loosening restrictions. Manitoba is about 6 weeks behind BC and Ontario in terms of the onset of COVID, but we've seen low numbers for over a week and appear to be flattening the curve quicker than other provinces maybe. By looking at our numbers and comparing them to other provinces, do you think Manitoba can lead the way and be the first province to move ahead with lifting restrictions?
So we're going to let our numbers guide it. So certainly the numbers aren't the only factor. We want to ensure that we're ramping up the ability to test because we'll need that increasing demand. We want to ensure that we have all of the at-risk populations protected. So we're working, still putting some measures in at personal care homes as we move forward. We've restricted travel to the north and we're really locking down the travel internationally and now the self-isolation order for interprovincial. So there's a number of things that are fitting into place and we're going to continue looking at those numbers, and if we do see them down then we're going to have to very cautiously start reopening things, but watching those numbers very cautiously as we do that.
Marnie, I'll just add to your question and say, I don't know if you're into acronyms, but I like this one. First, in restoring safe services together. That's our goal, but we have to create the safety. That's where increased testing, that's where protocols around reopening and so on are central to our restoration of safe services. And so that is our goal. And Manitobans, if this works, Manitobans will be the reason, not the only reason, but the key reason that we'll be able to be the first in restoring safe services together.
From the Brandon Sun, Drew.
Thank you. This is Drew Mason with Brandon Sun. Mr. Premier, on the topic of the cuts to universities, when do you anticipate that these will actually come into effect?
Well, I wouldn't anticipate cuts anywhere. What we're in the middle of is an activity of bringing together ideas. We're asking for people to participate in finding ways to share resources with our frontline people. Because just for example, with our protective equipment, the doctor well knows we're into hundreds upon hundreds of millions of dollars just for protective equipment for frontline health workers. And there are many, many other expenditures. While our private sector is in many categories shutting down. We've seen just last month over 25,000 Manitobans lost their jobs, virtually all in the private sector. So we're asking for partnership here to come up with ideas, and no one in the public sector believes that they are anything but a public servant. And so they understand that we're in this together. We're here to serve each other, public and private. And so we're asking for partnerships and suggestions to come forward. I expect that they will, because I believe it's our obligation to do everything we can to support our front line and to do the right thing to sustain our services going forward.
And just to follow up on that, a little bit earlier you were saying that you're asking provincially funded organizations to find appropriate savings. Can you comment at all on what you consider appropriate savings to be?
Sure, absolutely. We're asking them to come up with plans for savings anywhere from 10 to 30%. We already know, and we're not asking for a big chunk of our public service to come up with any savings at all. That would be, as you would quite likely predict, our social services, education. In terms of the high school education, our teachers are working right now educating as best they can our children, and in terms of our healthcare system. So that leaves less than a third of our public service and our Crown corporations and post-secondary institutions to come up with plans, and that's exactly what we're asking them to do. And I think that they want to be part of the team, and the response has been, for the most part, been very good in terms of people coming back with ideas. We've had some coming in already. We're looking for more because we're in an unprecedented time and we're fighting this pandemic together as Manitobans. All of us have a part to play.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, with respect to the latest death, are you able to say if the woman was in hospital, sort of which health region she was from, or if she had any underlying health conditions?
This was in Winnipeg and in the intensive care with the underlying conditions.
Thank you. And then just as a follow-up, are you able to say where we stand on the public health investigation into the province's fifth death from COVID-19, a woman in her 60s from the Prairie Mountain Health Region? Have we learned anything more on where she maybe contracted COVID-19?
I don't have anything to report on where that was acquired.
From the Winnipeg Sun, Scott.
Hi, it's Scott Villa from the Big Sun. First question for Premier Pallister. Just wondering, with this 10 to 30%, whatever you want to call it, ideas to shift resources to front lines, how many resources? I mean, we're talking money here. How much money are you looking to save in a dollar figure here?
Well, I'll tell you when we get the ideas, Scott. In the meantime, I think it's important to understand that we're in the middle of an historic pandemic without precedent, that we anticipate that we will be borrowing as much as $5 billion additional dollars in this fiscal year to fight this pandemic, and that we are the leading province in Canada per capita on debt now. So to do anything but to try to find resources beyond simply going and borrowing more from our kids and grandkids would be irresponsible, and I'm not an irresponsible premier. And so I'm asking all hands on deck here to look for ways to find legitimate savings in services that are non-essential so that we can make those resources available where they are needed on the front line.
Okay, my follow-up for Dr. Roussin. With testing criteria expanded already in some cases, and then only seeing kind of marginal increases in tests done, is it the case that there simply aren't that many symptomatic people at the moment, or is the criteria just not expanded enough at this point to see a higher rise in test numbers?
Yeah, that could be playing a role. This is typically where respiratory season is dropping down. We certainly see a decrease in hospital admissions and attendance at acute care facilities for respiratory infections, so it certainly plays a role. Some of the social distancing strategies that we have in place prevent the transmission of other type of respiratory viruses as well. So we're going to see we increased the testing criteria just last Thursday, then had a weekend in between there, so we're going to need a few more days to see whether these criteria are expansive enough, and if not, then we'll continue to expand the criteria.
I just want to close my part of this by saying again thank you to Dr. Roussin for his tremendous work. I also think that a lot fewer Jets games is having a positive impact, sadly, but it needs to. As we follow the advice Dr. Roussin has provided us with, and we continue to do that, we can beat this thing together. Thank you.
Thank you very much. And a reminder to everyone, we are now preparing the room for Dr. Roussin and Lanette Siragusa. We'll be right back.
Good afternoon. I'm Lanette Siragusa from Shared Health, Chief Nursing Officer. As we've discussed previously in past conversations, as this virus, this pandemic evolves, as we change how we manage it, as we wait for a vaccine to arrive, whenever that may be, there is going to be hills and valleys in our approach to how we deal with the system and serving patients. So as we pull back on some areas as part of our approach to preventing the spread of the virus, there's also at the same time a constant reassessment to look at where we can ramp up services at the same time. So non-urgent diagnostic procedures, surgical procedures, some of the primary care visits, and certain types of in-home care have been postponed, deferred, or moved to being offered virtually over the last couple of weeks. And in the case of diagnostic and surgical procedures, case-by-case clinical analysis is constantly being done to identify cases that may be postponed without resulting in negative outcomes for patients. So part of this ongoing clinical assessment, patients are asked to make sure that if there's any change in status or condition, that they let their provider know. And the clinical experts are reviewing cases to determine any that may become more urgent during this postponement time frame. We are planning for the moment when the surgical activity or diagnostics may need to ramp up again for a period of time in order to ensure patient outcomes are not compromised. This week, the surgery program at Health Sciences Centre will be increasing surgical activity in some areas to deal with oncology surgery in both the main operating room as well as at Women's Hospital. Planning continues to occur at other sites across the province to account for these periods of increased need. This includes ongoing clinical assessment of other areas where short-term postponement of clinical activity may be possible without compromising patient safety. And I also just wanted to give a thanks to everybody who goes above and beyond for others that as we work through this ongoing challenge. Every day my email is flooded with stories about wonderful gestures and acts of kindness. And this weekend there were some frontline staff at a personal care home in Southern Health Santa Sud region who decorated their PPE with funny faces to bring some joy and smiles to the residents at a time when they can't see their loved ones. As well, I heard about a physician who purchased 30 tablets with his own money and donated them all to patients to keep them entertained and communicate with their loved ones. And this doctor doesn't want to make a big deal out of this, and he doesn't want his name mentioned, but it is an incredibly generous act. And there continues to be donations of food from various businesses to show appreciation for healthcare workers at facilities across the province. The Bridge Drive-In, BDI for instance, donated 2,000 ice cream sandwiches to the Grace Hospital Foundation over the weekend. And these are lovely gestures that reflect Manitoba's reputation for coming together and helping out in times of need. So thank you for sending me those stories, and it's important to remember those through this time. Let's keep it going, and let's open the line to questions.
Thank you. A reminder to our reporters online, due to our time constraints, we'll just take whatever questions you have. Please proceed.
Dr. Roussin, I have a question about the public health order. Sorry, it's a free-for-all. It gets a bit messy. The extension of the emergency, the state of emergency, does that mean the public health orders are also extended to a certain date? I assume the end of May?
No, the public health orders are separate. So the public health orders are in effect until May 1st, and will be continually evaluated.
Thank you.
And Dr. Roussin, on that note, Dr. Kivaser at CBC, that means the state of emergency is extended to May 20th?
They was extended for 30 days. So
today's April 20th. I'm assuming that's how many days in April 30? I'm assuming that's May 20th?
That's sounds right.
Hello, Dr. Roussin. It's Mohammed from Radio Canada. I just have a question about COVID-19 in First Nation communities. Are there any cases reported in First Nation communities in Manitoba?
Not to our knowledge, there is not, no.
Thank you very much. And as a follow-up, I would like also to ask, we have some viewers who are saying that they were tested positive for COVID-19 and they were then considered as a result case 14 days later because they were still symptomatic. And they see a problem in the fact that they said they couldn't get tested again, even with the symptoms. Is it common, and why aren't we testing again people who are symptomatic after being considered resolved?
Right, so it's a good question. So the nature of the test, the molecular testing, doesn't test for a viable virus. It doesn't test whether you're infectious. It just tests whether there's some of the molecular material of the virus there. So somebody who is a case gets better, they could sometimes still test positive for weeks after they're no longer infectious. That test is that sensitive. So that's why we don't rely on that test as a test to cure. We know from the evidence that almost everyone is not infectious any further if they're asymptomatic, and it's about 10 days after the symptoms developed. So in Manitoba, we've done the 14 days and asymptomatic as that safety feature.
Thank you very much.
Dr. Roussin, Diana from ABC JLB, just following up on an earlier question, is there concern that Manitoba is the fifth person to die from COVID-19 in Manitoba? Is there concern that she acquired COVID-19 in hospital?
The fifth case is the one you're talking about. So, like I say, they're still investigating that because this virus has up to a 14-day incubation period. It's sometimes difficult to know where somebody acquired it. So I don't have details to share on that. I'm sure the contact investigation has been completed and contacts notified, and certainly if there was a reason to disseminate knowledge widely about where someone acquired it, we will certainly do so. But at this point, I don't have anything specific on that.
Thank you.
Michelle Gerling from CTV. Lanette, I'm wondering why you're reopening the surgical program at HSC in women. What about the situation there is allowing for us to do more procedures again?
Well, as you know, Health Science Center is our trauma center. They do the most complex surgeries and have some diagnostic procedures, equipment that no other site has available to them. So they serve on a provincial need. And so for cases, they've slowed down. I think it's been now 3 or 4 weeks, which is a long time to slow down. And it's just natural that at some point you have to open up the gates a little bit. And I am doubtful that it'll be fully functioning like they are normally, but they do have to start opening up a little bit just to get the flow of surgeries going. And there's address wait times, address any growing concerns that maybe could have waited 3 weeks, but maybe shouldn't be waiting much longer than that. So that was always part of the plan, that we would slow down, we'd see what this virus, what this pandemic was going to bring, and then shift the services as required when we can.
Hi, it's Carol. I'm Marty Roussin.
Go ahead.
Hi, Dr. Roussin. It's Carol at the Free Press. I just have a question about a memo that was sent by you from Shared Health to all healthcare workers on the weekend. It was telling them that their doctor's notes exempting them from work and from doctors prescribing specific PPE that they might need because of a pre-existing condition or for another reason, that the doctor's note would be superseded by OSH. And I'm just wondering, is there a problem with people coming to work with notes or missing work with doctor's notes because of concerns about COVID-19? Just what was the rationale for that memo?
Well, I think it was that a lot of the PPE and the utilization of the PPE is we have guidelines for that, and so we were relying on occupational health to provide the guidance on which PPE should be used in which circumstance. And so if there was a concern from an employee, then it's best in the hands of OSH, who can evaluate the nature of the job and then the nature of the PPE required, rather than relying on a note like that. It's challenging times right now, so we wanted just to have that done at a place where we knew our guidelines would be able to be followed. So certainly all those things will be taken into consideration, but we wanted the experts to be able to have the final decision on what type of PPE should be used in any given situation.
So the doctors who were writing the doctor's notes for work exemptions weren't experts?
Well, it might not be on the nature of COVID in the workplace. So that's our, occupational health specialists. We have occupational health physicians, and so that would be where we'd want the final decision with. Not that there wouldn't be any, review of the concern. It's just that we wanted the occupational health specialists to be able to weigh in on this.
Dr. Roussin, hoping that you could, just the numbers today, projections out of Ontario showed that they only have, or the caseload is around 20,000. They expected 80,000 based on their models, and I'm not even sure if that was even worst case scenario. Is this the sort of issue that you've had with modeling and maybe delaying what modeling does come out from you?
Yeah, well, I think the one is our modeling is based on the data you can put in. So our numbers have been quite low, so it's really tough to rely on a modeling number from that. But just modeling in general is like this. We know that models just provide a possibility, usually quite a large range, but it doesn't really tell you what is going to happen. It just helps with some of the planning. So you can see that when you release this modeling data, it's usually the norm that what actually does happen isn't what's in the model like that. So we been working on that for planning, but again, because our numbers are looking like this, it's something we're still going to be working on before we release any specifics.
Dr. Roussin, can you just explain,
So capacity for testing has been ramped up, but the criteria is the same as it was last week. Is that correct?
As of Thursday. So it was just on Thursday that we expanded the criteria. So we've had, had that one day and then now a weekend. So we're going to see this week if that expanded criteria is really going to drive demand.
Thank you, everyone. And that concludes today's media briefing.
Thanks.